When I put my uniform on, I'm ready to help someone on the worst day of their life.
Oh. It's the ambulance here, mate.
As soon as we arrive, they just know they're in safe hands and that we're going to do everything we can to help them.
Does that feel better? Yeah?
I wouldn't have guessed you were 104.
I genuinely think laughter is the best medicine.
Let's go. Teddy wants to go. You're very brave.
To know that you bring someone that's very unwell to hospital and they get better. It's one of the best feelings in the world.
I promise I'll look after you.
Second to God, these people.
Let's get you in the ambulance, eh?
I feel really proud to wear this uniform and I feel really proud to be a paramedic.
On this episode of Paramedics...
Wow, it never happened to him before.
A father of 3 is suddenly struck down by frightening seizures.
He veered off, started drooling. I'm so confused and terrified. Couldn't imagine life without him.
A much-loved grandma collapses at home.
Very calm, very cunning.
We don't know how long that she's been unconscious for. If it's a long period of time, she could be in real trouble.
Please be careful of the shoulder.
And just how much damage has Daredevil Jonty done to himself in this sickening crash?
Oh. I've been racing for 5 years.
And are you the best?
I'm not the best, I'm shit.
It's a busy afternoon at South Australia's Emergency Operations Centre. On the line is a worried wife.
What's the address there, ma'am?
Oh, I'm not on an address. I'm at Paris Hills at a bus stop. My husband was driving our car and he just pulled over really quickly.
The woman's husband has suddenly lost all control while driving her and their 1-year-old daughter.
He's diabetic and he's just saying that he might just need something to eat, but he just started sitting and, like, crying and dribbling.
We're coming urgently.
Intensive care paramedic Dan has been dispatched to the emergency.
We're off to a bus stop, or near a bus stop. Somebody's in their car. Apparently, they might be seizing, but we think it's related to diabetes. So I imagine they've got a low blood sugar, which can sometimes lead people to having seizures, so it's a time-critical emergency. So, should be somewhere at this next intersection. One of the first thoughts that goes through my mind, seeing a seizing patient pulled over on the side of the road, is, thank God he was able to pull over. I hate to think of the consequences for him, for anybody else on the road, because he could have easily had a crash at full speed.
Do you know what I did this morning?
What did you do this morning?
I went and got some Botox.
Just like my microneedling.
A bit different.
Beauty therapy? Oh, that's good. You don't need Botox.
Yes, I do.
Oh, you got it in your grumpy wrinkles.
That my grumpy wrinkles, yeah.
It's the start of shift for Aaron and Laura. As usual, there's no secrets between these 2 long-time work buddies.
You could probably get some.
Probably.
These little lines here.
But I'd look... No, my lines are my lines.
But the great Botox debate is quickly shelved as an SOS comes in from a motocross rider in serious trouble.
So we are going to the Gilman motocross track. 17-year-old male has come off the track. Right shoulder looks deformed.
Might have landed on his shoulder, dislocated his shoulder. Either way, it's going to hurt him. Although I ride bikes myself, you would never catch me on a motocross track, ever. It's way too fast, you jump way too high, it's just far too dangerous for me.
Oh my God, they're just going, oh my God, it's actually scaring me watching them. I can't be a parent because if my kid wants to get into this stuff, I can't support it. Definitely when you see these kids, you think, oh, like this can cause some serious damage. So when we get there, we find out Jonty is already being treated in an event medical responders ambulance.
Hello. Good, thank you. How are you?
It's really good that I can get like an initial handover from a paramedic that's already done a first assessment.
Hello, how you going? Jonty, is it? Jonty, all right. Okay, been a bit of the wards, have you?
Yeah, had a bit of a bust up.
Yeah, all right. I'll just get handover from this guy here.
So it's been competing, travelling less than 60k an hour.
Less than 60?
So gone over his handlebars,
Yep.
directly down onto the right shoulder.
Yep, okay, yep.
Injured the right eye, so it's actually whacked his eye.
Yeah.
Shattered the visor on his helmet. He's got a video of it.
Can you just airdrop that to me?
While Laura is being briefed, Aaron has tracked down a video of the accident.
Thanks, man. Appreciate it.
Video of you coming off. Wait, which one is he? Oh, God, that comes off. Oh, yeah, okay. That was pretty nasty.
So in the video, Jonty's going really quite quickly. He goes over a jump and then he lands the jump, but the bike kind of slides out from underneath him and he just crashes into the ground. It's obvious that he does hit the ground with his shoulder first and it did take an impact, but he could also have head injuries, he could also have internal bleeding, just the way his body kind of rolled and fell on the ground. It's quite gruesome.
"37-year-old Agostino has just suffered an extreme seizure while driving. A paramedic crew is already with him, and intensive care paramedic Dan has been called in as backup.
Hey guys, how are you? Howdy, how are you? G'day, mate.
Our short version is ongoing partial seizures.
Yeah, okay.
He's conscious throughout.
Blood pressure?
160 on 100.
And sugars?
Was having a hypo at 3.4.
Yep.
Reversed with some oral, last was 6.8.
Simon, the paramedic, tells me that he's managed to get the sugars back up to normal, and yet we're still having this seizure-type activity. Usually once we get the sugar levels back to normal, the seizure activity will, at the very least, slow down, but usually stop reasonably soon after. So this is surprising now.
Agostino's wife, Amy, and baby daughter, Oriana, were also in the car when the young dad was struck down with the first confronting seizure.
As we were just coming home from the cemetery where his mum is, he veered off, hunched over, started drooling, put his foot on the accelerator, and I just didn't know what to do. So I grabbed the steering wheel and then just guided into a bus stop, put the handbrake on and just got out the car, and I was like, what is going on? I'm just looking at him making these strange movements, and I'm so confused and terrified all at the same time.
And then he's just had these recurrent episodes where he's drooling, arms and legs twitching.
How often does that happen?
It's probably had like a total of 6 in the last 15 minutes.
Wow, never happened to him before.
No.
To hear that Agostino's had 6 seizure-type activities, and this is the first time ever that this has happened to him, it is quite concerning.
Just gonna check your blood pressure again.
If a seizure is prolonged over many, many minutes, we can start leading into the territory of brain damage and eventual death.
You know what we need to do soon? What's that? Make some more homebrew beers.
Oh, they were probably some of the best beers I've ever had.
Yeah. What about the second batch, though?
Probably one of the worst beers I've ever had.
They were horrible.
The Chris and Sam bromance is back on duty, and the boys are adding a bit of interest to their day with a small side bet.
Do you know what word you've got to work into this job?
Tell me.
Astronaut.
Astronaut?
Yeah.
No pressure.
What's mine?
Yours is humpback whale.
Sometimes we work pretty long hours and go to some pretty heavy things, so a bit of humour here and there just makes the day a bit easier for us.
With the challenge set, the boys are ready for their first job of the day.
All right, Chris, we are going priority 3 to an 80-year-old female
She has slipped over in the laundry and thinks she's dislocated her kneecap, is in severe pain. Yeah. Knee dislocations can be really painful. I've dislocated a shoulder before and it was excruciating, so I'm really feeling for this patient. G'day, how are you? Here for Gloria. Lead the way for me, thanks, sir. Sorry, what was your name again? James. James, all right. Let's see what Gloria's done, hey?
I just want you to step in.
Sure. Oh, hello, Gloria. Hello, I'm Sam, this is Chris. All right, what's happened, Gloria?
I came out and I slipped.
Yeah?
So painful, like
Yeah, sure.
I just can't move.
Okay, all right. Why do you think you fell? Did you lose balance or you were dizzy or
water.
Slipped in some water?
Yeah.
How bad is your pain out of 10? If 10 is the worst pain imaginable, just have to get a whistle like that. Yeah, sure.
Yeah, I'd say 8
pretty severe. Yeah.
Easily.
Now, it might make you feel a little bit loopy and you'll tell us all your secrets. So just remember, James is still here, so let's not say anything too incriminating about him.
I heard Gloria fall, and then this little plaintive voice, Jim. Her right leg was bent, right angles, and she was in tears and grimacing in anguish and the pain. It wasn't just a matter of dust yourself off and I'll get you a cup of tea. I could see the damage was done.
Now, I need to cut these pants to have a look at your knee without pushing them up and hurting you even more. So you're happy if I cut them? All right. I've seen some pretty nasty injuries with dislocations and fractures and things like that.
That's the way.
It can be a pretty confronting sight for some people to, you know, see their knee sticking out at right angles or breaks in the legs. We're hoping it's not going to be too nasty an injury for Gloria.
That's the way. Nice big breaths. You're doing really, really well. Good.
Have you ever done anything like this before?
I had a big one at Canada in 2020.
Okay, and what kind of injuries did you sustain then?
Ruptured spleen, punctured lung.
Jesus. Oh, okay. Just a small one then?
Yeah.
Just a small little injury. And you're back doing it?
Yep.
Alrighty.
Serial daredevil Jonty is being treated by Laura and Aaron after the 17-year-old came off his bike at high speed. It's almost certain Jonty has dislocated his shoulder, but the paramedics are more worried about internal bleeding or spinal injuries.
No, you want to film him?
Yeah, I mean, it's up to him. Your friends want to film you. Is that okay?
It's all right, yeah.
All right.
What have you done, Ranger?
So I'm worried that Jonty's got a head injury and some internal bleeding, and he's having a laugh with his mates.
Bit of a bust-up. Bit of a bust-up, eh?
Bit of a bust-up. Not the first time either. But in all seriousness, he has had a major trauma, and we do really need to get him to hospital.
Just please be careful of the shoulder.
Yeah, so 1, 2, 3. All right, stay nice and still, mate.
Jonty's mates are giving him a rock star send-off, and he is loving every minute of it.
All right, say goodbye to your friends.
Jonty's mum, Carolyn, joins her son for the trip to hospital.
Pain here.
Yeah, up a little bit high, but don't touch it, please.
Yep, okay, all right. No worries. Once we moved Jonty, he was complaining of some like upper limb, hip groin pain. Just here?
Down a little bit lower, please press
there, okay. That was concerning to me, obviously given his accident, he could potentially have a femur fracture or like a pelvic fracture, and those can be very serious injuries and can result in some bleeding as well.
Just keep your legs still for a sec, mate.
Keep very still, Jonty. Hold still,
Ow.
hold still, hold stuck.
All right, so just going to drop some medication. So when that's happening, are you aware that it's happening, that your legs are moving and whatnot? They are moving. Yeah, good man, good man.
Intensive care paramedic Dan is trying to work out why diabetic Agostino is suddenly experiencing a series of extreme seizures.
Right, so you know exactly what's going on?
Yeah.
Other physical things like your eyesight and all that, is that all normal?
It's fine.
All normal? See an ugly bloke in front of you?
Pretty much.
Oh, hang on.
Yeah, I've seen everything.
Yeah, good.
Except when I start.
Yep.
I just start spitting.
You start spitting and not able to talk.
Dan first thought low blood sugar could be the trigger, but the seizures continue even now the sugar levels have returned to normal.
Let's pop this on. You've got no heart troubles at all?
As far as I know.
No. So it's just the diabetes. Anything else?
The condition my mum had.
Okay. Do you know what it was called?
Yes. It's called MELAS.
MELAS.
Yeah. Mitochondrial endocrine.
Yep.
Lactic acidosis.
Okay.
Syndrome.
Right.
MELAS is a rare neurological condition that affects the nervous system. It causes stroke-like symptoms, which can lead to brain damage and is hereditary.
My mum had 2 strokes. She had a heart attack before that.
Agostino then tells me that his mum died from this condition in her 50s. And here's this man before me with a young daughter thinking that this could be the first day that he encounters this progressive disease. What an awful realisation that would be.
So we're not sure what's causing your movements, but this medication might help settle it and make you feel more comfortable. All right, your oxygen's perfect, your heart rate's perfect, your ECG looks good. We can check it more in a minute.
While Dan and Agostino head to the hospital.
So that was your wife back there?
Yeah.
His distraught wife, Amy, is following behind.
Agostino's mum passed away because of MELAS. MELAS becoming a reality for Agostino is nothing short of terrifying.
Before today,
Nothing's happened.
nothing has happened. This is the first time that something might be related to it. Might be. Okay.
I couldn't imagine life without him. No. No way.
So that was your wife back there?
My little one.
Your little one? How old's she?
As I'm speaking to Agostino, his speech now completely changes.
There'll be one tomorrow.
One tomorrow?
Yeah.
Wow. You got a party lined up?
We had on Sunday.
Oh, lovely.
It becomes really slurred, slumps to the side. He's got these involuntary movements again in his legs.
Yeah. Now, you're aware of how you're speaking at the moment? Yeah. Okay.
So whatever it is that's causing these episodes, it now seems to me they're getting a little bit longer and a little bit worse.
That's all right. Nice big breaths. You're doing really, really well.
Sam and Chris have come to the rescue of 81-year-old Gloria. She slipped over in her laundry and is now in excruciating pain with a badly damaged knee.
Like, there's definitely a bit of bruising around there. It doesn't look as bad as I thought it was going to.
That's good.
Yeah. I don't doubt that you've injured it and there's potentially some damage to something, whether it be a bone or some ligaments or tendons or something like that.
Good.
Obviously, at her age, her bones are a bit weaker than younger people's, so as much as it might look like just a dislocation, we're worried that there might be a fracture as well. Gloria, I'm just going to check your blood pressure again and then give you another little dose of the nasal spray, just to make sure you're as comfortable as possible before we go to move you. Gloria is in significant pain with this knee. If we can't get this pain under control, it's going to be really difficult to move her.
I'll put my foot there. You can push against my foot if you need to. That's it.
While we're helping Gloria up, Chris pops his big hoof in front of her feet just to stabilise her. And I've gone, this is my opportunity. It's humpback whale time.
I feel like I'm towering over you here.
It's a big foot, Chris. Big as a humpback whale.
I'm extremely impressed that Sam managed to get humpback whale into his conversation. After I've heard Sam say that, I've thought, right, game on.
We're going to get you to go pretty hard on the whistle for probably 10 to 20 breaths and try to get you a little bit zonked on that.
We'll get you as high as an astronaut and then we'll try and get you up onto the chair.
I don't know whether it was the mask or whether Sam wasn't expecting it, but he did not flinch.
How do you feel on that whistle? Bit of a strange feeling, isn't it?
Yes, it's magic.
It is magic, yes. The magic whistle. Like having a couple of shandies. Full it all. All right, I'm going to take the whistle for a sec. OK, on 3, big push. 1, 2, 3.
Oh.
Good work.
Oh. Thanks.
And we can go back down now. That's the way.
Good work. All right,
Well done.
Just sit there for a sec.
That's okay. Once we get Gloria onto the green chair, we take her backwards, out through the house, out towards the stretcher, where we can get her hopefully a little bit more comfortable.
I'll take that seatbelt off you. That's okay. You're so polite, Gloria.
You are. There we go.
I feel a bit drunk.
Yeah, that means the whistle's working. Now, I'm going to hold on to this arm.
She's the love of my life, Gloria. Yeah, no, she means the world to me.
Jingle, you get a part in there.
Sam and Chris are doing a great job. And I'm concerned that it's going to be worst case scenario, that there's something smashed there. It's not going to be just a quick visit to the hospital and somebody's going to fix it. Oh, it's pretty devastating.
We'll look after you.
Thank you.
Not as good as James, but, you know.
We've done a whole lot better than I would.
Thanks, boys.
Okay. You're very, very welcome.
Ow.
And how does that hurt? Can you describe that pain?
It's like, it feels like a bruise. You're pressing on a fat bruise. I don't know, it just really hurt.
Accident-prone daredevil Jonty is starting to feel intense pain in his legs and back after crashing during a motocross race.
Maybe give some more suspension.
The force of the impact has the paramedics concerned about a potential broken back or life-altering spinal damage.
He didn't have any splayed legs or massive swelling to his thigh, so those are all good signs, but the reality is there's some injuries that only X-rays and imaging will show.
This is not the first time Mum Carolyn has been in the back of an ambulance with her son.
I didn't see the actual accident as it happened. I caught the last part of him tumbling through the air and then looked over and went, please get up, get up. I just wanted him to get up and walk, because you just think, what have they broken now? How bad is the injury? Has he still got, is he paraplegic? Because all of these things can, race through your head. We've seen lots of other injuries and you just think, oh God, not my kid.
All right, we can go.
We can go?
Yeah.
No, I'm not going to give you your phone. You need to just suck on the lid.
What do you want your phone for so badly?
I want to message the boys.
The boys are all here, mate. Okay, the boys
gave you a bloody standing ovation on the way in.
And they're all standing there now still. Okay.
I like to have a bit of fun, but I have to get my mum voice on because it's really annoying. I feel like I'm a teacher and my students keep getting their phones out in class.
Please, Mum. Please.
Jonty, can you look at me for a second? Okay, we're going to be 10 minutes to the right and then you can have your phone, okay?
For dinner.
So we just need to wait because we need to keep giving you pain relief and we need to do a few things, okay? I know, very annoying. But just give us a second.
Okay, it's okay, mate.
Laura's mum voice comes out. It's serious time, and Jonty, word of advice, don't argue back.
All right, I'm going to give you some paracetamol through your vein, so I need your arm to be down.
SA ambulance service, tell me exactly what's happened.
I just come to my grandma's house and I had to go through the back door and she's unresponsive on the couch and she feels really clammy.
All right, I'm going to get you some help. Are you with her now?
Yes.
Is she awake?
She had her eyes open for a moment, but she's unresponsive.
Is she still unconscious?
Yes.
Listen carefully, lay her flat on her back and remove anything from under her head.
I can't move her. I can't move her. She sounds like she's gurgling and choking.
Thank you.
Solo responder Bill is on his way to the unconscious grandma, but heavy traffic is slowing him down.
Oh, this is a nasty intersection, this one. Thank you, everyone.
As Bill negotiates the traffic jam, a paramedic crew has just arrived at the house and are sending updates.
Patient is still unresponsive. Time for lactic.
From what it sounds like, the first responder has found that this patient has got a low blood sugar level. So what we'll do is we'll try to get some sugar into her body, whether it be by mouth or by her bloodstream, as soon as we can.
So a severe hypoglycemic episode is extremely dangerous. We know that if you're left in this for too long, you can have a seizure, you can potentially slip into a coma and die. And we don't know how severe her diabetes is, so the longer that she's suffering from a severe hypoglycemic episode, the more danger she's in.
Knock, knock.
G'day. Hey guys.
How you going? I'm Bill. How can I help?
This is Olga. How old is she?
She's 81.
Olga lives by herself. This is her granddaughter, Catherine, who's visiting. Stayed with her yesterday, spent the day with her. She has been, well, due to safety tonight, got here about 4 o'clock. Found her sitting up on a responsive, incomprehensible sound. Very cold, very clammy.
So she's had a whole bag of dextrose?
No, not the whole bag.
150 mils? Cool. I'll get another sugar level.
The paramedics have started administering dextrose, hoping this will help rebalance Olga's dangerously low sugar levels.
Do we know when she was last seen?
No, I
Or heard from?
Yesterday.
Yesterday.
I saw her. I left here about 3 o'clock.
Okay. It's a huge worry that we don't know how long Olga's been unconscious for. If it's a short period of time, then we know that we can potentially reverse it quickly. If it's a long period of time, she could be in real trouble.
How you going there, mate? You still with me?
37-year-old Agostino has suddenly lost control of his speech and limbs after suffering a series of debilitating seizures.
Yeah. You just feel like you haven't got control over that.
The father of 3 is now facing the brutal realisation that he could have developed the crippling genetic disease MELAS that took his mother's life at only 50 years of age. But right now, intensive care paramedic Dan is just trying to bring the life-threatening seizures under control.
The danger with repeat seizures is the brain is not getting time to recover and has not fully recovered. If the seizure goes for too long, we will end up with permanent damage. I'll be able to give you a little bit more medicine. So I'm going to treat Agostino with more anticonvulsant or anti-seizure medication. All right, because we want you to feel comfortable with it. But I'm also aware we don't really know what's causing it at this point. We need to just keep an open mind. So we don't want to give you too much other medicine.
I'm good then.
All right. Hopefully, we'll be able to stop the seizure activity completely, and if not completely, at least stop its severity so he's not in so much distress.
As the ambulance approaches the hospital, the medication appears to be working. Agostino's seizures have finally subsided, and he is once again able to communicate to Dan.
I haven't been here since my daughter was born.
Born here, yeah. I'm glad that today we've been able to safely get Agostino to hospital, but unfortunately it might just be step 1 in the process. If it happens to be a life-altering genetic condition that's been unmasked, this is going to be a long road ahead for Agostino and his family.
That's flushed for you. That's just saline.
Is that running still?
That's running beautifully.
81-year-old Olga is unconscious after suffering a dangerous hypoglycemic episode. Bill and the team are giving her dextrose to replenish her sugar levels, hoping she will wake up on her own.
So, potentially last seen yesterday?
Yeah.
Olga was found unresponsive by her granddaughter. Catherine had come to town to spend time with her grandmother.
She wasn't answering the door or the phone, so I just jumped the side fence and found her on the couch. Eyes open, but not really responding, just sort of groaning and really, really sweaty and clammy and cold. I knew that it was a good sign. She was still breathing, but I didn't know how long that was going to last.
My grandma calls me once every month, and this time she asked me if I was ever going to visit her before she died. That really stuck with me when she said that. She is such a beautiful lady, so caring, so nurturing and so loving.
Okay, so
Just another intro. Oh, we're waking up. Hello. You're okay. There we go.
Thankfully, the treatment has worked, and Olga has regained consciousness.
You all right? Yeah.
Hello, Olga. How you going? Good.
We need to give Olga some time to reset, because once you've had a hypo, your brain has been starved of a lot of oxygen and a lot of sugar. And we know that the brain needs those nutrients to be able to think properly and to be able to recognise the people that we love.
Hello. What are you doing down there?
Olga's daughter, Fofi, has rushed to be by her mother's side.
She's still waking up. She's all right.
She does seem like she's coming back around again. We still haven't probably reached 100%, but it might take a little while for that.
Yeah, sugar levels have been all over the shop.
Okay, is she on any new medication for that?
The only thing she's the new one is a blood pressure tablet.
Okay.
How's that?
Yeah, I'm all right.
We need to investigate exactly what's caused Olga to have a hypo, because that could be a number of things. That could be simply due to new medication or something more sinister like a stroke or an infection somewhere that we're unaware of.
We've got a chair right behind you.
So she definitely needs to go to the hospital for an assessment.
What are you doing? I'm all right. Yeah, you're all right.
But as Olga continues to wake up, the very independent 81-year-old is not sure about the plan.
What's going on? He's blacked out. His artery was too low and he collapsed. Oh, I'm not going to do you did.
Olga, can I help you stand up and then we'll sit on this?
What's up? I'm all right.
We're going to get you checked out. Your blood sugar levels are a bit too low.
Well, let me die.
Oh, we can't let you die.
How's your pain in the knee at the moment? Not too bad?
It's a good one. Thank you.
It's okay.
You all do such wonderful work. It's very important.
Paramedics Chris and Sam are on their way to hospital with 81-year-old Gloria. After a horror fall in her laundry, it looks like she's fractured her kneecap. But right now, Gloria's only worried about one thing. If she's going to miss out on a charity event later in the week, raising money for cancer.
We call ourselves the Hot Chilies.
The Hot Chilies?
Yeah. And it's afternoon tea at the Bartley Hotel.
Right. Afternoon tea with the Hot Chilies.
Yes, yes. And it's a lot of work and still got lots to do. So
Yeah. Oh, good on you for doing all of that.
every little bit helps, doesn't it?
Yes. Chris, did you hear Gloria talking about a fundraising team, the Hot Chilies?
For where, sorry?
They're called the Hot Chilies.
The Hot Chilies?
Group of 7 ladies.
I like that.
Do little fundraising efforts. Well, big fundraising efforts. I think that says a lot about Gloria's character and the fact that she's not concerned about herself, she's just concerned about being able to get out there and help people, and I really feel for her.
Lovely Gloria is fast becoming a favourite with the boys, and the pain relief has taken her mind off her badly damaged knee.
Jim and I've been married nearly 40 years.
Oh, lovely.
Yes.
How did you meet him?
I met him at a nightclub.
Oh.
At a nightclub, did I hear?
That's how you meet them, Chris? At the
Not at
nightclub?
a dance.
Did you meet him on the dance floor, or...?
No, it was a bit worse for wear, to be honest. He was over from interstate.
Right.
Yes.
And you looked after him that night, did you?
No, I didn't like him.
Oh. So he liked you that night, but you didn't like him?
He was keen.
Yeah, I bet he was. There's hope for you yet, Chris.
Oh, I'm sure, Chris, I'm sure.
Hey, we're here.
Gloria will now go in for x-rays on her knee, but Chris and Sam are worried the big-hearted charity queen will be facing surgery and weeks of rehab.
If Gloria has fractured her patella, it's a good chance she's not going to be walking around for a fair while. This is going to severely impact her charity work, and I can imagine that she's going to be a little bit upset by that news.
I've got a mask for you.
Thanks, dear.
It's okay. Gloria is such a genuinely nice person. She raises all this money for all these different charities. We need more people like Gloria in the world.
How you doing? Apart from the dodgy driving.
No.
It's all right, you're being polite.
Keep that arm nice.
Call Shah. FaceTime Shah. Let me FaceTime Shah, Mum.
No,
Run upstairs.
no.
Who's Shah? Oh, keep it.
Elbow straight, mate.
Oh, I'm
elbow
sorry.
straight.
Badly injured motocross rider Jonty is on his way to hospital after a frightening high-impact crash.
Jonty's
Hold on. Hold on.
The thrill seeker has dislocated his shoulder, and Laura is still worried her young patient may also have sustained spinal damage or internal injuries from the major trauma. Jonty, however, seems less concerned.
How long you been riding for? Since you were how old?
5 years about now, but I've been riding my whole life. I've been racing for 5 years.
And are you the best?
I'm not the best, I'm shit.
The honesty. The honesty is real.
Humble.
Yeah.
Humble king. Did you just say green whistle me Mama G? Oh.
The paramedics have done what they can for Jonty. It's now time to hand him over to the hospital, where he'll undergo a series of x-rays and scans to uncover the true extent of his injuries.
What's my Uber rating? 5 stars?
5-star Uber rating?
Nice, I did.
Although things are looking pretty good for Jonty, given how fast he came off that bike, he still has to be screened for major trauma. You never know, especially with something as severe as his crash was, there could be a lot of underlying things going on.
Let me die.
Oh, we can't let you die.
Intensive care paramedic Bill is trying to get the reluctant Olga into an ambulance. After a life-threatening hypo, she needs to be checked out at hospital.
Come on, yeah, we got to get on the bed.
You have to get on the bed, Mum.
We've got to get on the bed.
Beautiful. Yeah, I'll give you some help.
I'm going to check you out.
Luckily, daughter Fofi and granddaughter Catherine are on hand to help convince the stubborn 81-year-old.
There you go. And step off that one and then pop your bottom right up there. Well done.
That's better.
I can't feel that out.
You were sleeping.
Had the honour of having my grandma and my grandpa bring me up. They came to Australia with nothing and worked hard. We didn't really have money, we just had love. So yeah, really, really close.
I love you. Okay.
Olga was extremely worried about the whole situation, and my job isn't just to sit there and treat her medically, but also try to connect with her, to try to settle some of her nerves. How you going there, Olga?
I'm all right.
Do you mind if I take a little bit of blood? 1, 2, 3. Whoop. 4.7. We're on the way back down, Olga. Next item on the agenda, sandwich.
I don't want to.
Oh, it's pretty good, though.
I know, I can't eat it.
We need to get your sugar levels up.
Well, let me die.
You're too young to die, Olga.
No, I'm not too young.
Want me to set up another bag of glucose?
Yeah. What we're going to do is we're going to have that sandwich a bit later. Can you hold my hands? Give them a big squeeze as hard as you can. Oh, that's enough. That's tight. Good job. I think you've passed the test.
Bill has managed to take the feisty Olga out of immediate danger, but he's still worried an infection or stroke could be the reasons behind her dangerously fluctuating blood sugar levels.
Lovely. You're good to go. Thank goodness Kat called the ambulance and that we're now here being able to give Olga a fighting chance. Olga definitely needs to find out what the primary cause of her problem is. So fingers crossed she keeps that tenacity and that feistiness, that she'll be able to get home nice and quickly. It was lovely to meet you.
Nice to meet you too. Thanks for your help.
That's okay. See you later. Bye.
There's potentially some damage to something, whether it be a bone or some ligaments or tendons.
81-year-old Gloria slipped and fell on her knee while doing the laundry. Doctors discovered she had a nasty fracture of the kneecap. With her leg put in a brace, Gloria was warned it could take her months to walk properly again.
Here's the leg.
Getting sore.
Oh, you're doing well.
Sadly, the charity queen missed out on her afternoon tea fundraiser with the hot chilies. But 2 weeks later, Gloria insisted on leaving hospital and returned home to her husband.
It was really nice to have her home. She was still in a lot of pain.
It's this little bit in here that worries me.
Yeah. So I had to make sure that she was comfortable, feed her and look after her.
But James isn't Gloria's only hero.
Takes a lot to impress Chris, and he's impressed, so...
Her short time with Chris and Sam left a lasting impression.
Jim and I have been married nearly 40 years.
Oh, lovely.
Yeah.
She spent a couple of hours with those guys, but Gloria still talks about them as if they're family members.
How you doing? Apart from the dodgy driving.
They were gorgeous. That's the only word I could say. They were delightful, gorgeous young men. I think they all need gold medals. And any girl would be very, very lucky to meet them. Oh, boy.
I might just watch a quick video of you, mate, coming off, all right? Oh, that was pretty nasty.
6 weeks ago, motocross rider Jonty came off his bike mid-race.
Please be careful of the shoulder.
Yeah.
X-rays showed he had a fractured shoulder, torn bicep and severe concussion.
Chuck that under there.
Jonty was given strict instructions from the doctors to stay off his bike until his body healed. The daredevil knew it was a lucky escape.
I definitely was thinking this could possibly be a broken back or something like that, because your legs touching the back of your head is not something your body's supposed to do.
Today, at last, Jonty's been given the all clear to ride again.
I'm stoked to finally get back on. I'd like to be more cautious, but that's not going to happen. I'm always got to keep that adrenaline coming in. I won't ever slow down, I don't reckon.
Much-loved grandmother Olga suffered a life-threatening low blood sugar episode at home.
Found her sitting up and was false to very cold, very clammy.
Granddaughter Catherine saved her beloved Yaya when she dropped by and found her unconscious. After several days of tests, Olga was cleared of any signs of a stroke and allowed to return home. 4 weeks ago, father of 3, Agostino, suffered his first seizure while driving with his wife and baby daughter in the car.
So we're not sure what's causing your movements.
Intensive care paramedic Dan did everything he could to stop the wave of terrifying seizures.
This medication might help settle it and make you feel more comfortable.
Agostino feared it was the beginning of the devastating genetic disorder, MELAS. With a young family to look after, Agostino and Amy waited for the neurologist's verdict.
7! 6! Yeah!
They did rule out MELAS. He has not got MELAS. This is not a MELAS symptom. However, he has dissociative seizures, which is essentially a conscious seizure where he's having seizures that he can speak through. It's not affecting his brain.
Ah, no, that's cheating.
It won't scar his brain.
1, 2, 3, I win. Go, Gory, go! Go, George.
But those unpredictable seizures have now forced Agostino to hand in his driver's licence.
Losing my licence is you lose your freedom, but I'm okay. You have to be. You have to get through it. That's what life is. You can't dwell on things and you miss the important things if you're too busy dwelling on the bad. So just roll with the punches and just keep going. Whee! Love you. Mwah!